PCOS, Polycystic Ovary Syndrome, is a hormonal disorder causing enlarged ovaries with small cysts on the outer edge of your uterus. PCOS can cause missed or irregular menstrual periods, excessive hair growth, acne, infertility, and weight gain. Women with PCOS may be at higher risk for type 2 diabetes, high blood pressure, heart problems, and endometrial cancer. It is a very serious condition affecting most young girls these days. Let us understand from Dr. Bharati Morey, who is a renowned gynecologist and is practicing in Shakuntala Women's Hospital since 3 decades, more about this condition and how can we tackle this condition. Let us talk to Dr. Bharati Morey.
Good afternoon, friends. This is Dr. Bharati Morey from Navi Mumbai, practicing gynecologist and obstetrician for last 30 years. Today we are going to discuss PCOD or PCOS. PCOD is polycystic ovarian disease. In PCOS, what happens is the ovaries, they don't release the eggs, and therefore what happens is the cysts are formed. That is the PCOS, polycystic ovarian syndrome. And in the disease is a severe form of polycystic ovarian syndrome where it starts rupturing the eggs, but they are abnormal eggs. And because of the abnormal eggs ruptured, there's a hormonal imbalance. And because of the hormonal imbalance, there's a total mess in the malar interior of the ovary, which gets reflected in the body. So friends, what is the main problems that these girls are facing, or the women with PCOS or PCOD are facing? Well, the incidence is something like 6% in India, and globally it is 4 to 21%, which is quite high. If not taken care in time, then it can give rise to life-threatening conditions like type 2 diabetes mellitus. Like, because of the changes in the body, they have low image about their body. Therefore, they can go in depression and have great psychological problems. Because of obesity, they again have a negative impact of their body image. They get indrawn from the society, like to remain alone. And because of obesity, there is sleep apnea at times, which is dangerous if not taken care in time. Over the period, if you don't take care, you have type 2 diabetes mellitus, you have endometrial hyperplasia because of the unopposed estrogen, and therefore chances of getting cancer endometrium. Moreover, because of the excess of androgen, you can have masculine image, that is, you have excess of hair at abnormal places, like you can have a mustache, or the hairline can be a little longer. You can have baldness of head, or you can have blackening at the nape of the neck, and disturbed body image. Now, because of all these things happening, you have to take care of the PCOD or PCOS. Also, you might have hyperlipidemia, and because of hyperlipidemia, if not taken care in time, she can have X syndrome, where because of the increased lipids and the cholesterol, she is more prone for cardiovascular accidents, especially postmenopausal. So PCOD is a disturbance in the body, which is because of the hormonal changes, and it gets reflected on the physique also. If not taken care, then it can cause all those things which I've already mentioned. So what is the main investigations that one could do? The investigations, usually we are practicing here for last 30 years. So nowadays the incidence of a mother coming with a daughter with history of irregular periods, it could be the amenorrhea or more frequent periods with lot of weight gain, and the girl being withdrawn, not going for her classes, sitting in one room, and whenever she studies she keeps on hogging, so increased weight. So all these things are there, and the mother comes, and the mother is slim and trim, but the girl is obese. This is the picture seen, and the main presentation is irregular periods with acne, hirsutism, and sometimes sleep disturbances and obesity. So they have a disturbed body image. What are the investigations they would ask for? The investigations is, first of all, the clinical examination. Then you have the blood test. Blood test is most important thing is you're going to do her blood sugars, you do her HbA1c, and you do her testosterone to rule out other causes of hyperandrogenism. which could be other than the ovary. Once you have ruled that, then you can label her as PCO. If she is more than 8 years after menarche and she has these symptoms like at least 2 of the 3, irregular periods, obesity, hyperandrogenism, and then you can do a sonography. Because she's an unmarried girl, you can't do a PV examination. With PR, you can hardly get any information, especially because they're obese. So whole abdomen sonography is asked for, and there you can see pearl necklace pattern, that is more than 25 cysts of 2 to 9 mm on both the sides of the ovaries with increased ovarian volume of more than 10 cc. Then you can diagnose her as PCOD. Once diagnosed, the management is, most important thing is change of lifestyle, where you go for a brisk morning walk every day and you do some exercises every day, whichever exercises you like. Either you go swimming or you can do aerobics, whichever, or cycling, whichever you like. Then 10% of your weight loss you have to do. 10% of whatever is the weight you have to lose, at least 5 to 10%. Third important thing is a diet should be low carbohydrate, high protein diet. Diet may, you have to have your dinner before 8 o'clock. Most important thing to avoid is avoid the kachra food. What I mean by kachra food? Ragda patties, pani puri, your hamburgers, your pizzas, your momos, all this should be avoided. You should have more fruits, have more berries, you have more strawberries, have all colorful vegetables. It should be a higher effort diet so that you have a proper stool formation, which also helps for weight loss. Another thing is mostly they are anxious and they are, women taking stress for small things. So you have to tell them, don't take stress for small things, go for a brisk walk, do singing or dancing, whatever they feel which could relieve their stress, go for power yoga. Because if not taken care, they'll have anxiety and depression, which is very important to be taken care. So if taken care in time, we are going to really bring down the incidence of PCOD, and the incidence of all the complications will occur because of PCOD. Of course, once they are in their marriageable ages, then you are more bothered about childbearing. So PCOD leads to infertility. So you have to take care of that when she is in the age of childbearing. After the age of 40, when she is perimenopausal, more chances of endometrial hyperplasia with chances of endometrium, more chances of hyperlipidemia, and increased cholesterol with her going in syndrome X and metabolic syndromes with attached, accompanying severe cardiovascular changes which take place, and more chances of myocardial infarction with cerebrovascular accidents which could lead to her being, bedridden, which no woman wants. So my dear friends, in short, I've explained to you what is PCO, what is PCOS, and how we can take care of it and conquer PCO and have a normal life. Thank you.